Yeah, I think one of the main benefits is junior surgeons can get significant exposure to an operation which they would otherwise maybe spend hours standing around in the operating theatre waiting for the critical point of it, and then the critical part of it takes a very short amount of time. There'll often be intense supervision, often with another surgeon literally guiding their hands to do the critical part of the operation. And the immediate feedback that you get is not forthcoming as it is in this simulation. So with this simulation we're trying to put a metal screw into the bony part of the spine. It sounds fairly simple, it's putting a screw into a bone. The difficulty is there's a spinal cord in the middle of it, which it's imperative to not hit, and there's also the nerves going to the legs, which is imperative not to hit. You also don't want to fracture the spine, which would cause the bones to become destabilised and require even more surgery. So it's a fairly tricky thing to do. You need to have exactly the right angles, well, exactly the right starting point to put the screws in. You need to have exactly the right angles to get it to miss the spinal cord, miss the nerves, and get into good quality bone to get good purchase. You need to have it at the correct depth so that the screw does the best work it can. And this gives you immediate feedback of how you've done. If you don't get it right first time, you can immediately go back, figure out what you've done wrong and correct it. And I think that that's, in this situation, this is fantastic that it gives you immediate feedback. It means that the quite steep learning curve can be essentially learnt offline or off a patient. And I think that I've done this procedure a large number of times, but I still learned quite a lot from it today, being able to get the immediate feedback. If I do this operation on a patient, I will have some feedback from the X-ray that I get during the surgery. The absolute feedback, which is really for to see exactly where the screws have gone and for quality control. This scan is done the next day, and there's a usually 24-hour, sometimes longer separation between the memory of the operation, feeling exactly what you felt during the operation, and seeing the exact result of it. With this, we get immediate feedback. The screw goes in, you look up at the screen, and it tells you exactly how wrong you were, or exactly how right you were. And that is fantastic. If you get it right immediately, you reproduce that. If you don't get it right immediately, then you can immediately correct that without anyone coming to any harm.